Let's start with the borders of the back. The superior border passes through the external occipital protuberance and the superior nuchal line. The inferior border passes through the sacroiliac joints, posterior segments of the crests of the ilium bones, and the coccyx. The lateral border is the posterior median line. Watch more videos in the EasyAnatomy app. With EasyAnatomy, you can learn much easier and faster. We provide a comprehensive video library, related PDF notes, and atlas sections with engaging flashcards. Download EasyAnatomy from the link in the description. There are several anatomical regions within the back. The vertebral region, the scapular region, the infrascapular region, the lumbar region, and the sacral region. The muscles of the back are located within these regions. They are arranged in two layers, a superficial and a deep one. In this video, we will learn about the superficial muscles of the back. These include the trapezius muscle, the latissimus dorsi muscle, the rhomboid major muscle, the rhomboid minor muscle, the levator scapulae muscle, the serratus posterior superior muscle, and the serratus posterior inferior muscle. Let us examine each muscle in greater detail. Trapezius muscle. Origin. The descending part arises from the external occipital protuberance, superior nuchal line, spinous processes of vertebrae, and the nuchal ligament. The transverse part arises from the spinous processes of the first to fourth thoracic vertebrae. The ascending part arises from the spinous processes of the 5th to 12th thoracic vertebrae. Insertion. The descending part inserts into the external third of the clavicle. The transverse part inserts into the acromion of the scapula and the spine of the scapula. The ascending part inserts into the spine of the scapula. Function. The descending part brings the scapula closer to the spine, superiorly and medially, helps to extend the cervical spine, helps to turn the head to the contralateral side. The transverse part pulls the scapula medially. The ascending part pulls the scapula inferiorly and medially. The following structures innervate the muscle and supply it with blood. The latissimus dorsi muscle. Origin. The vertebral part arises from the spinous processes of the 7th to 12th thoracic vertebrae and the thoracolumbar fascia. The iliac part arises from the posterior third of the iliac crest. The costal part arises from the ribs 9 to 12. The scapular part arises from the lower angle of the scapula. It inserts into the crest of the lesser tubercle of the humerus. Function. Arm pronation, arm adduction, and arm extension. Also, it slightly participates in the act of breathing. The following structures innervate the muscle and supply it with blood. The following muscles are located slightly deeper than the previous ones. The levator scapulae muscle. It originates from the transverse processes of the 1st to 4th cervical vertebrae and inserts into the medial margin of the scapula, between the superior angle and the spine. Function. It pulls the scapula superiorly and medially, shifts the articular cavity inferiorly, and tilts the head ipsilaterally. The following structures innervate the muscle and supply it with blood. The rhomboid major muscle. It originates from the spinous processes of the 2nd to 5th thoracic vertebrae and inserts into the medial margin of the scapula, between the inferior angle and the spine. Function: it pulls the scapula superiorly and medially, shifts the articular cavity inferiorly. The following structures innervate the muscle and supply it with blood. The rhomboid minor muscle. It originates from the nuchal ligament, spinous processes of the 7th cervical to 1st thoracic vertebrae, and inserts into the medial margin of the spine of the scapula and the scapula itself. Function: it pulls the scapula superiorly and medially, and shifts the articular cavity inferiorly. The following structures innervate the muscle and supply it with blood. The serratus posterior superior muscle. It originates from the spinous ligament, spinous processes of the 7th cervical to 3rd thoracic vertebrae, and inserts into the superior margins of the ribs 2 to 5. Function: it lifts the ribs and participates in the act of inhalation. The following structures innervate the muscle and supply it with blood. The serratus posterior inferior muscle. It originates from the spinous processes of the 11th thoracic to 2nd lumbar vertebrae, and inserts into the inferior margins of the ribs 9 to 12. Function: it lowers the ribs. The following structures innervate the muscle and supply it with blood.